Yo, what's up? My name is Darius Glenn. First and foremost, I want to thank you guys for clicking on today's video. If you have not done so, please subscribe, share, hit that thumbs up button. And in today's video, we're going to discuss the differences between a licensed practical nurse, LPN, versus an RN registered nurse. Let's get into it. So, RN versus LPN. Let's start with schooling. Schooling might determine which one you want to be. For most people, sometimes they just want to get a decent career that pays well and not a whole lot of schooling. Some others would like to pursue higher level of education, and then in return comes more opportunities, more pay. So with LPNs, typically is a 1-year degree. So it's not an associate's degree, but it's typically a nursing program. 1 year, they become a licensed practical nurse. Their job outlook is usually in long-term care, rehab facilities. And then if you complete another year of schooling, you can get your associate's degree in nursing. At that point in time, you will take your national licensure exam and you will be a registered nurse. Now let's talk about scope of practice. As a RN, you have a broader scope of practice than an LPN. So you can do complex assessment, medication administration, and nursing care plans. And not to say that you cannot do all those things in LPN, like you can administer certain medications as a licensed practical nurse, but you have a broader range of medications that you can administer as a registered nurse. LPNs have a more focused practice, often providing basic nursing care, administering medications, and assisting with certain medical procedures under the supervision of the RN and/or physician. All right, so let's talk about patient care. When it comes to patient care, RNs typically take on more complex and critical patient responsibilities. For an example, my background, again, for those of you who don't know, my background is an ICU nurse. So as an LPN, you cannot become an ICU nurse without being a registered nurse. So let's say ICU is something that you really wanted to do, but then you're gonna have to go on to get that extra year at least to become a registered nurse, get into the ICU, interventional radiology, cath lab. If you're into any of those critical cares, ER, then you're gonna have to do that extra schooling. So if that's your thing, there's your layout there. And if you're not into that, then we'll keep on moving forward and talk about the LPN responsibilities. LPNs are typically more involved in routine aspects of patient care. For an example, long-term care facilities. They usually get a lot of patients. They're very busy, lots of patients. They have their set schedules. They're like, okay, we gotta go to this patient, these meds, this patient, these meds, this patient, these meds. And then sometimes by the time they're done with that, it's like clockwork. You gotta kind of do it all over. There's tasks in between, but it's more of a, again, the key word is more of a routine manner. To elaborate a little bit further, it's healthcare, okay? I mean, anything can happen in any setting at any given point in time. It's just that's more of a scheduled field, whereas in the hospital, kind of more chaotic. All right, so supervision and autonomy. RNs typically have more autonomy than an LPN, and RNs may supervise the LPNs, nursing assistants, and other healthcare staff. And when it comes to work settings, I kind of already touched on this, but again, RNs will have more of a variety of options when it comes to work settings. Hospitals, clinics, schools, LPNs kind of have that also. I think the really big difference is when it comes to specialization. RNs can get into crazy specialties that LPNs may not be able to get into, or for sure can't get into, depending on what that specialty is, where it's located. Different states have different scopes of practices, like LPNs in California, which actually I think are called LVNs, licensed vocational nurses, might have a different scope of practice than compared to the LPNs here in Arizona. But you have, just in general, more of a variety of options as a registered nurse. But if you want to do like school, You want to do long-term care, rehab facilities, then again, LPN might be more your route. If you just want a ton of options, limitless, in my opinion, the options are limitless as an RN, then that might be your route. All right, let's talk finances. So the differences when it comes to finances between a registered nurse and a licensed practical nurse varies on many factors such as location, education, specific healthcare settings. In general, RNs tend to earn a higher salary than LPNs due to the increased education and broader scope of practice. So the figures I'm about to give you guys are based specifically for the United States. For an RN, it can range between $60,000 to $100,000 plus, depending on the factors that I just mentioned earlier. LPNs generally have a lower median salary compared to RNs, but that's not to say that you can't go out there and make 60 plus as an LPN. I know people who do it. It's definitely attainable. It's just they're gonna get capped at a range that RNs can exceed. So LPN salaries, again in the United States, typically range between $40,000 to $60,000. Also, great income opportunities there. And I know this video is specifically between RN and LPNs, but if you're at the RN level and you want to further your education, nurse practitioner, CRNA, especially CRNAs, I know CRNAs, they can make up to $200,000 plus. So, if you really want to get to a higher level, then you're gonna have to just, more education typically comes more money. And let me just add in one more thing so I don't get attacked by people. The salaries vary based on states as well. Like Arizona and California don't pay the same rates compared to Oregon. Like every state is different. So just keep that in mind. All right, so before I close out the video, I just want to hit you guys with some quick facts from the Bureau of Labor Statistics about job outlooks for registered nurses. It's always important to know that, but it should not come with any surprise. The national average of job growth for 2022 to 2032, or the next 10 years basically, for registered nurses is 6%, and the average is 3%. So it's double than the average growth for all occupations. Again, no surprise. No statistic that they listed here is that there are about 193,100 openings for registered nurses projected each year on average. So clearly crazy demand. A lot of people are going to nursing school. It sounds like there's, oh my gosh, there's like so many people going to school for nurses, there's not going to be enough jobs, but like, believe it or not, guys, there is such a high demand that it's almost like nursing school is not even pumping out nurses fast enough. I used to do traveling and I get messages all of the time, multiple times a week from different agencies saying, hey, come travel here, come travel there. There is a high demand for registered nurses right now. So don't think that you're not gonna be able to find a job, because I promise you, you will. All right, so the statistic for the licensed practical nurses, job outlook on the same website from the Bureau of Labor Statistics, they predict from 2022 to 2032, again, 10-year span. The job outlook is 5% growth rather than 6% growth. Still crazy high demand, above average, and they're predicting that there's about 54,400 openings for licensed practical nurses and licensed vocational nurses projected each year as well. So still crazy high demand. No matter which route you go, guys, nursing is nursing. We're all in here to help patients because we care, right? So can't go wrong, but I hope you enjoyed this video, and I'll see you guys in the next one.